Most women know to do self-breast exams and look and feel for a lump, but there are other signs of breast cancer that can be sneaky.
In fact, a new study shows most women are unaware of some of the common symptoms of the most aggressive form. Dr. Stephanie Campbell with Kelsey-Seybold Clinic joins us live to discuss. Thanks so much for being here, doctor. Let's first talk about the self-exams and the lump. What should a woman be feeling for when doing her self-checks?
But we're feeling for anything that feels like a hard lump, so like a BB or an M&M, something that's not movable and typically not tender.
Breast cancers. The inflammatory breast cancer are the kind that can be hard to diagnose because of the subtle signs. Can you walk us through what a woman needs to know about here?
So the things that we look for in inflammatory breast cancer are going to be skin changes. It looks like a new rash, or sometimes it's wrinkling or pulling on the skin. Usually around the areola is where it's going to start.
Okay, another sign is one breast that feels warmer or heavier than the other?
Yes, so sometimes it can mimic an infection. Obviously a woman that's not breastfeeding or hasn't had an injury or a surgery should not be getting an infection in her breast. And so it can mimic that by the redness, the tenderness, the warmth, or feeling heavy, like you said.
What about changes in the skin of the breast? I've even heard doctors say that it almost appears like an orange peel, if you can picture what that would look like. It's sort of just a different texture almost.
Absolutely, that's actually what we call it, orange peel changes on the skin, and it's thickening of the top layer of the skin. So it actually does feel like an orange peel, very hard, very rough, very different from the normal skin around the breast.
Okay, and you also say any kind of pain should be a sign that you should get things checked out. What about a new lump, say in your armpit or even in your collarbone area? Most women may not link that to a possible case of breast cancer, right? But can that be suspect as well?
Absolutely. So we do worry about any new lumps in the armpit. That could be a lymph node that could indicate a deeper breast cancer that's now moved. There is a lot of breast tissue that goes up towards the clavicle. The tail of the breast tissue ends in the armpit here. So breast cancers can start in this area. So even a lump that seems like it's on the upper chest wall is concerning.
Let's talk about the importance of really just making sure that all women are doing these self-breast exams, because with inflammatory breast cancer, it's often caught late stage because people just aren't looking for these other things that we're talking about, or they just think, oh, it's no big deal, it'll go away.
Mm-hmm. Yes, so we do want people to be aware of their breasts. And typically breast cancers are caught during just a normal time, like bathing or dressing, or you go to put your bra on and you realize one cup seems smaller than the other. So we just want people to be aware of their breasts. If you are going to do breast exams, make sure you do it at the same time of your cycle every month. And if you're no longer having cycles, just pick a time of the month to always do it, because our breasts do change depending on hormonal influence. And so we just want women to notice if anything seems different or out of the ordinary to them, even a small rash that they're not sure about, to make sure that they're talking with their doctors.
Really helpful information. Dr. Stephanie Campbell from Kelsey-Seybold, thanks so much for joining us. Have a great weekend.
Thank you. You too.